CNA Practice Test Full Course 2026 Ultimate Certified Nursing Assistant Certification Study Guide. Question 1. What is the first step when preparing to give a bed bath? Wash the client's face. Check the water temperature. Lower the side rails. Identify the client and explain the procedure. Safety and communication come first. Always identify the resident and explain the task. Question 2. When a resident is on a restricted salt diet, the CNA should add extra pepper. Remove the salt shaker from the tray. Provide salt packets just in case. Encourage the resident to eat fast food. Following dietary restrictions is essential for managing conditions like hypertension. Question 3. To prevent pressure sores, a bedridden resident should be repositioned every hour, 2 hours, 4 hours, shift. Repositioning every 2 hours is the standard practice to relieve pressure on bony prominences. Question 4. Which of the following is an example of objective data? The resident says they have a headache. The resident says they feel nauseous. The resident's blood pressure is 140/90. The resident says they are lonely. Objective data is measurable or observable, signs, while subjective data is what the patient says, symptoms. Question 5. What is the proper way to measure a resident's height in bed? Use a tape measure from head to heel. Estimate based on their age. Ask the family. Wait until they can stand. For bedbound residents, a tape measure is used while the resident is supine and flat. Question 6. When assisting a resident with a weak left side to dress, which arm should be put in the sleeve first? The right arm. The left arm. Both arms at the same time. Whichever the resident prefers. Always dress the weak side first and undress the strong side first. Question 7. The abbreviation NPO means nothing by mouth. New patients only. Next shift only. Nightly per order. NPO stands for nil per OS, meaning nothing should be taken by mouth. Question 8. If a CNA sees another staff member hitting a resident, they must ignore it. Tell the staff member to stop. Report it immediately to the supervisor. Wait until the end of the shift to report it. Abuse must be reported immediately to ensure resident safety and comply with mandated reporting laws. Question 9. The best way to prevent the spread of infection is wearing gloves at all times, hand washing, using air freshener, keeping the room dark. Proper hand hygiene is the single most effective way to prevent infection transmission. Question 10. When performing perineal care on a female resident, the CNA should wipe back to front, front to back, in a circular motion, side to side. Wiping front to back prevents the transfer of bacteria from the anal area to the urethra. Question 11. What is a Fowler's position? Lying flat on the back. Lying on the stomach. Sitting up with the head of the bed raised 45 to 60 degrees. Lying on the side. Fowler's position is semi-upright, helpful for breathing and eating. Question 12. A resident is choking and cannot speak or cough. The CNA should give them a glass of water. Perform abdominal thrusts, Heimlich maneuver. Slap them on the back. Start CPR. Abdominal thrusts are the intervention for a complete airway obstruction in a conscious person. Question 13. Which of these is a sign of dehydration? Clear, pale urine. Moist skin. Dark, concentrated urine. High energy levels. Dark urine indicates a lack of fluid intake or fluid loss. Question 14. How should a CNA communicate with a resident who is hard of hearing? Shout loudly into their ear. Speak slowly and clearly while facing them. Avoid talking to them. Use only hand gestures. Facing the person allows them to see lip movements and facial expressions, and speaking clearly is better than shouting. Question 15. What is the primary goal of hospice care? To cure the illness. To provide comfort and pain management for terminal patients. To perform surgery. To provide physical therapy for recovery. Hospice focuses on quality of life and comfort, palliative care, rather than a cure. Question 16. When measuring a radial pulse, the CNA should use the thumb, the first 2 or 3 fingers, the palm of the hand, a stethoscope. Using the thumb is incorrect because the thumb has its own pulse. Question 17. A clear liquid diet includes milk and orange juice, apple juice and broth, pureed meat and potatoes, ice cream and pudding. Clear liquids are those you can see through at room temperature. Question 18. The ombudsman is a person who works as the facility administrator, acts as an advocate for residents' rights, prescribes medication, cleans the resident rooms. Ombudsmen are state-appointed advocates who investigate complaints and protect residents' rights. Question 19. Which of the following describes sundowning? Increased confusion and agitation in the evening. A type of skin rash. Waking up early in the morning. Improved memory during the day. Sundowning is a common symptom in dementia patients where behaviors worsen as daylight fades. Question 20. Standard precautions should be used only for residents with known infections. For all residents. Only when the nurse tells you to. Only in the bathroom. Standard precautions assume every person's blood and body fluids are potentially infectious.